wanted to take an opportunity to provide our media partners with clear information about what our community needs to know about the current respiratory season and available healthcare options. We appreciate your partnership in getting this important information out to the community. To give some context, Osler, like many other hospitals, sees more patients coming to us for care during the fall and winter months, and especially throughout the holiday period. The increase in patient visits is often caused by the seasonal rise in influenza, COVID-19, RSV, or respiratory syncytial virus, and other respiratory illnesses. However, it is also important to note that Osler serves a community with one of the highest growth rates of all large cities in Canada. This also has an impact on the capacity in the emergency departments at Brampton Civic and the Etobicoke General Hospital, Peel Memorial's Urgent Care Center, and across the organization. Along with a very high growth rate, Osler's community also has some of the highest rates of chronic disease, such as diabetes and cardiovascular disease in the province. This means our patients are often more severely ill patients compared to many other regions in Ontario. Osler proactively prepares for the expected seasonal increase in patient volumes, but sometimes the volumes or level of sickness in our emergency departments is due to other factors. Throughout the busy fall-winter season, our teams do everything they can to improve access to inpatient beds and reduce pressures on our emergency departments. And for that, we are most grateful. Osler has the most amazing staff, physicians, and volunteers. Osler also works closely with our healthcare and community partners to participate in vaccination and healthcare awareness campaigns. Our preparation is always important to ensure Osler can continue to provide the community with access to quality care closer to home. We're here and ready for our community 24/7. To support our efforts, we remind everyone who comes through our doors to please stay up to date with flu and COVID-19 vaccinations and RSV if eligible, not come to visit patients when sick, continue to practice hand hygiene, wear a mask when required, and follow other infection prevention and control measures as necessary, and seek care in the right place based on your symptoms and other medical conditions. I will now pass it over to my colleague, Dr. Rutledge, to speak more about the many options for care for our community.
To build a bit on what Kiki shared, Osler works in partnership with the Central West Ontario Health Team, Toronto and Peel Public Health, and other community health providers to provide clear communication on how residents can protect themselves during cold and flu season and where to go if they are ill, as well as what to do and expect if they come to the hospital. Understanding the many care options available ensures our community access to the right care at the right time. This is never more important than currently, as our emergency departments across the country and the province face increased capacity like many other hospitals. Osler's Nowhere to Go for Care campaign highlights what healthcare options are best for certain illnesses and injuries. At its basis, primary care physicians or family docs and nurse practitioners are a great resource for non-emergency conditions such as colds and flus, flu-like symptoms, or COVID-like symptoms, skin conditions, and management of long-term health conditions such as diabetes, blood pressure, or arthritis, among many other conditions. For current community members who are unable to get a timely appointment with their family doctor or don't have one, the regional virtual urgent care clinic is available 7 days a week. However, as Kiki had mentioned, Osler's Urgent Care at Peel Memorial is also available 24/7 for non-life-threatening illnesses and injuries such as sprains, broken bones, minor burns, earaches and eye injuries, infections, or nose and throat complaints. Similarly, our two emergency departments at Brampton Civic and Etobicoke General Hospital are always available 24/7 for medical emergencies and serious injuries or conditions. These include chest pain, shortness of breath, numbness or weakness in arms, major trauma, mental health issues, seizures, or stroke symptoms. Of note, I'd like to mention that parents should remember to take their unwell babies who are 6 months of age or younger to the emergency department. Ozer's emergency departments are the best place for them to receive care, as the urgent care center is not equipped to care for very young children currently at this time. To help manage expectations when visiting urgent care or one of the emergency departments, Osler provides wait time clocks available on our website at williamoslerhs.ca. While appreciating that waiting can be hard, I want to note that Osler's metrics on wait to see a physician in our emergency departments are in line with, and in some cases better than, other hospitals across the province. On behalf of Osler, we thank patients and families for their patience and understanding as we head into the busy fall and winter season, and appreciate their support. I would also like to take this opportunity on behalf of Osler leadership to acknowledge the tremendous hard work of our dedicated clinical and non-clinical teams who continue to ensure the community has access to quality care in their community. Before I conclude my remarks, I want to share a few tips to stay healthy. Wash your hands frequently, social distance when possible, wear a mask, especially if you have any upper respiratory system illnesses, and anytime you're seeing people who are at risk. Stay up to date on COVID-19 and flu vaccines. And if you do get sick, please stay home and rest.
Along with the cold and flu season, do we see any COVID cases in the hospitals? If yes, then how many cases are there?
Thanks, Mr. Chopra. I'm happy to take that one. We have seen a small increase in COVID numbers. In fact, we were just reviewing the numbers today. We don't have the exact numbers in front of us. We don't currently have any outbreaks in our hospital, fortunately. We had one that was just resolved, but there's been a mild increase. As Kiki mentioned, really what we're facing right now is more of the RSV. The early tail of RSV has been more pressured for us currently. But COVID is there and has been grumbling along, but not to a significant amount at this point.
My follow-up is, since the new COVID vaccine is out, and we have seen that that's already there. So why this is called the new COVID vaccine? Why not the fourth dose of COVID vaccine? And many of the Canadians now, they are hesitant to get this vaccine. And some of the doctors, they are recommended, some of doctors, they are not saying anything on this. So what is your recommendation about this new COVID vaccine? And why is it is not the fourth dose? To make so that the public can be clear in their mind that what actually it is. Thank you.
Yes, no, thank you. Very important question. So it is, I guess, technically the fourth dose, although you're right, they're not referring to that. The reason that being is it's subtly different how it's operating now. So it's not meant to be a booster. If you can imagine back to the dark days of the pandemic, we talked about booster doses moving along. This one isn't actually meant to booster. This is really targeting, they've had some time to breathe and look at what the type of variants are. And this is targeting several different variants that they're now seeing as the active portion of COVID. And so they're viewing it as a new vaccine with a new target that's allowing for increased public safety. With respect to our recommendations, certainly we're recommending that everyone who is eligible get the new COVID vaccination, in particular, but not limited to those who have immunocompromised state, again, other cancers, other reasons that they might be unwell, the elderly who we know we've now gained much more information over the years of the pandemic. We know those are the individuals who could really have quite a difficult course with COVID. And there's great evidence that vaccine limits the severity of the course and limits the hospitalization, which is obviously important for all of us.